I'm Ian Olver from the University of Adelaide, and I'd like to talk about applying a framework that was designed to guide policy on healthcare resource allocation decisions to data linkage projects. This was a framework from the NHMRC from the Australian Health Ethics Committee. So data linkage of population health data sets or health data with non-health data often involves balancing ethical principles such as concerns about privacy of individuals with beneficence as represented by the more general public good. And this is a very similar ethical dilemma that can occur in health resource allocation decisions. Linking population outcome data with administrative data sets is one way of providing evidence for those health resource distribution decisions. So looking at a framework for the decision making can be quite instructive. So what the Australian Health Ethics Committee did was produce a paper on ethical considerations regarding to healthcare resource allocation decisions by publishing a framework to guide policy. And we think this framework could be applied to ensure the justification of data linkage projects that is defensible and in the interests of the public good. The four main conditions for legitimacy of policy decisions about access to healthcare in a democracy with a public health system and limited resources were examined for their relevance to decisions about the use of public data and linking data sets. So what are the necessary conditions for health resource allocation? Well, for a public policy decision to be democratically defensible, the decision-making must be responsive to the interests of those affected right across the community. Policy decision makers should articulate their reasoning and recommendations so that citizens can judge them. And while the context of policy decisions will differ, their legitimacy depends upon four pillars: transparency of the reasoning, accountability of the decision makers, testability of the evidence informing the decision, and the inclusive recognition of all of those, in fact, that the decision affects. Now, in terms of transparency, the criteria for making decisions about data linkage must be recorded, why this was done, and it has to be reported widely. And those making the decisions, because of their expertise in a particular area, must declare any potential conflicts of interest. For example, public policy in a health system may be seeking to reduce costs, but this may be different from an individual health consumer's needs. But the policy decisions can be formulated as long as each party knows what is driving the other. The transparency of process here, though, does not mandate that all information must be shared. There's often sensitive health information. It's more that the process be transparent. In terms of accountability, the decision makers must be accountable to the wider community. Now, this often means that the community has a chance to question the decision, or in fact, that there's an avenue of appeal open to the community. In data linkage terms, clearly the processes for the linkage must be articulated so they can be held to account. And in terms of the data created, is there any other way of achieving the endpoint that perhaps has less risk than the proposed linkage? That must be articulated. Accountability requires seeking the appropriate expertise so that, if necessary, the evidence generated can be investigated independently. In terms of testability, that really means the independent appraisal of the strength of the evidence, which ultimately will result in a policy decision. It may mean reconsidering that policy decision, particularly in the occasion of evidence rapidly changing. So you must be able to change a policy if further evidence is published, and that ability to change must be preserved. Sometimes you can test your findings from a linked data set with a separate linked set on a completely different population. Inclusiveness is very important. Inclusiveness recognises that decisions made on behalf of a whole community sometimes discount issues that affect only part of the community, resulting in systemic disadvantage. In other words, many decisions are made for the greatest good of the greatest number, and that can leave out vulnerable minorities, for example. In ethical terms, the bioethicist John Rawls suggests that a just system of distribution is one, in fact, in which the worst off will be better than they would under any other distribution. And this is in order to address these disparities. So inclusiveness in decisions about data linkage would support transparency and accountability by creating a means for those who are going to be affected by the outcome to be involved in that decision-making process. It doesn't necessarily mean that they'll influence the process, but the decision-making body must have a broad mix of perspectives, expertise and experience when the whole community are affected. But of course, that must include those with the most pressing needs. So if that's the framework, what's an example of the application to data linkage? And I think a particularly good example was a paper published by Smith and colleagues looking at survival, mortality and morbidity outcomes after esophagogastric cancer surgery in New South Wales. It was published in the MJA in 2014. And this was a study where data from the New South Wales Cancer Registry, the National Death Index, and the New South Wales Admitted Patient Data Collection, an administrative data set, were linked together. And the aim of doing that was to inform policy about how to achieve greater efficiency and, in fact, better outcomes for esophagogastric surgery. And like other data sets overseas, the result of this showed that the best results in esophagogastric surgery were achieved in high volume hospitals. It wasn't even high volume surgeons, that the whole system needed to be used to dealing with this type of surgery in order to get the best results. And so the policy implications of that would be to restrict these procedures to high volume hospitals. But in fact, the data linkage study, which was widely published and so met all the requirements of transparency and accountability of those pursuing the research, this study underpinned the policy decision that could result from it. So in conclusion, I make the point that the principles of transparency, accountability, testability and inclusiveness can be applied to decisions about data linkage projects. And if they do, this will help promote society accepting those projects. It will be clear to society the advantage from the information obtained would be well balanced against any concerns of ethical risks such as individual privacy concerns. And we must do this to promote the public utility of data linkage. Resulting policy would be defensible and clearly responsive to the interests of all those affected. Thank you.